Now students, let's take this video on anti-cancer drugs. Now anti-cancer drugs, in this chapter we'll be studying the anti-cancer drugs plus immunomodulators. Okay, so these two categories will be completing in this particular video. Now anti-cancer drugs are basically drugs which kill the cancer cells, right? Now these drugs, they also kill the normal cells, and because of that they are toxic. They cause their toxicities. The most common toxicities are bone marrow suppression, alopecia, mucositis, right? These are the common toxicities which are seen. Now anti-neoplastic drugs or anti-cancer drugs are divided on the basis of cell cycle specific or cell cycle non-specific. Okay, cell cycle specific drugs, basically they are effective when the cells are dividing, right? And cell cycles non-specific drugs are active even in resting phase. So even when the cells are not dividing, these drugs are effective. So they are classified as cell cycle specific and CCNS, that is non-specific. Now in non-specific drugs, a non-specific category, we have alkylating agents. Okay, that is the first category. Then we have platinum compounds, in which we have cisplatin, carboplatin. We'll be seeing them individually also. Then we have anthracycline derivatives, that is doxorubicin, daunorubicin, metoxantron. Then we have antibiotics also, which are active against tumors like dactinomycin or mitomycin. So these are the drugs which are cell cycle not specific. Then coming to the cell cycle specific category, now here they are anti-metabolites. Here these are the drugs which mainly act on DNA part. So anti-metabolites are here. Then topoisomerase inhibitors, right? Anti-metabolites में हमारे पास methotrexate, mercaptopurine, thioguanine, fluorouracil, capecitabine, ये सब आती हैं. Topoisomerase inhibitors में we have tecans, irinotecan, topotecan, etoposide, bleomycin. Then we have vinca alkaloids. Okay, so vinca alkaloids में we have vincristin, vinblastin, vinorelbin. Then we have taxanes, in which we have docetaxel, paclitaxel, and cabazitaxel, right? Then there are some newer agents also which are acting. We'll be seeing their names also one by one. Okay, so anti-cancer drugs, they basically can be considered under 4 categories. First are cytotoxic drugs. Second is considered as a targeted chemotherapy, targeted drugs. Then we have hormones, and hormones which act as anti-cancer drugs. And then we have miscellaneous, in which we cover various new category drugs. So we'll be studying the anti-cancer drugs under these 4 categories. Let us start them one by one. So the first category of drugs, that is cytotoxic drugs. Cytotoxic drugs means which are damaging to the cell. So in this, the first category that let's discuss is alkylating agents, right? Now what are these alkylating agents doing? These mechanism of action पहले समझते हैं. What is their mechanism of action? They basically, these drugs, they are cell cycle non-specific, so they act on resting as well as dividing cells. Now these, as the name itself suggests, they alkylate the nucleophilic groups on DNA basis, right? And in this, N7 of guanine is most susceptible. Okay, so they alkylate the nucleophilic groups on DNA basis, and then because of this action they lead to cross-linking of base. Then they can cause abnormal base pairing, right? And they also cause DNA strand breakage. So this is the action of alkylating agents. And what are the side effects that they cause? What are the adverse effects that they can cause? They cause GI distress, bone marrow suppression, alopecia, secondary leukemias, and sterility, right? So these are the common side effects seen with these drugs. What are the names of drugs in this category? Let's see the names also. Now the classifications are very difficult in anti-cancer drugs. So we have nitrogen mustards, in which we have, I'll take one name, cyclophosphamide, right? Then other drug in this is ifosfamide, melphalan, chlorambucil, the more commonly known drugs, right? Then we have ethylene amines, in which we have thiotepa, then hexamethyl melamine, then alkyl groups, that is busulfan, then nitrosoureas, in which we have carmustine, lomustine, right? Then another category we have is triazines, in which we have procarbazine, dacarbazine, and temozolomide, right? So these are the anti-alkylating agents. So ये हमने इसका मैकेनिज्म ऑफ एक्शन देखा, और हमने देखा कि इसका साइड इफेक्ट्स क्या क्या होते हैं. अब इसमें देखते हैं सबसे पहले नाइट्रोजन मस्टर्ड्स को देखते हैं, जिसमें हमने पढ़ी थी cyclophosphamide. What is the drug? Prodrug cyclophosphamide. The main prototype drug is cyclophosphamide, and it is a prodrug, right? It gets converted to on metabolism, gets converted to aldophosphamide. One of the degradation products of aldophosphamide is acrolein, and this acrolein causes hemorrhagic cystitis, right? This hemorrhagic cystitis can be treated by a drug called as Mesna. The full form is mercapto ethane sulfonic acid plus hydration. A vigorous hydration needs to be given. Okay? So this is a very important side effect of cyclophosphamide, and it is normally asked in questions also. Second side effect that it causes is pulmonary toxicity. Then it can also cause syndrome of inappropriate ADH secretion. Okay? So this is one drug. Then there is one drug, ifosfamide. Ifosfamide, it produces a compound which is called as chloracetyldehyde, and this is nephrotoxic. Then it also produces acrolein, so that is also toxic. So ifosfamide, देखा जाए तो it has higher risk of neurotoxicity, nephrotoxicity, and bladder toxicity, right? Then a very important part here is that cyclophosphamide is drug of choice for a disease which is called as Wegener's granulomatosis. Okay, so this is the use of cyclophosphamide also. Then there is a drug which is called as miclorethamin. This is used in Hodgkin's disease. It is also a vesicant, right? Then there is a drug melphalan, which is the drug of choice in multiple myeloma, right? Then some more drugs. That is next category drugs that we see is nitrosoureas. Now these nitrosoureas, इसके अंदर कौन कौन सी drugs आती हैं? Carmustine, lomustine, and semustine, right? These are the drugs that come under nitrosoureas. They are highly lipid soluble, and because of this they cross the blood-brain barrier. So they are used in brain tumors. They are used in brain tumors like gliomas, right? They cause delayed neutropenia. Okay? Then other drug, one more drug is there, dacarbazine. Dacarbazine, it basically affects the RNA and protein synthesis, does not affect the DNA. And then there is one more drug, streptozocin. It also destroys the beta cells of pancreas. Okay? Other alkylating agents. Let's see what are they. So in other alkylating agents we have busulfan. Now busulfan causes pulmonary fibrosis, skin hyperpigmentation, and also hyperuricemia. Then there is a drug which is procarbazine. It is leukemiogenic. It also causes disulfiram like reaction with alcohol. Okay? Procarbazine also causes hypnosis and vivid dreams, right? Then another drug is there, that is chlorambucil. Now chlorambucil spares myelocytes, and it is used in CLL. Okay? Next drug is lurbinectedin. Now this is an alkylating agent. It also inhibits RNA polymerase 2. This is approved for treatment of small cell lung carcinoma. It causes hepatotoxicity. That is the side effect which is seen with lurbinectin, right? Next we come to platinum compounds. Now in platinum compounds we have cisplatin, carboplatin, and oxaliplatin, right? Now these drugs are not alkylating agents, but they are discussed here because of the same mechanism of action. Now only difference is that instead of alkylation they insert platinum is inserted to form the dimers of DNA. मतलब जैसे alkylating agents जो है alkyl group को incorporate कर रहे थे ना DNA nucleotides में, यहाँ पे instead of alkyl group platinum is inserted, and as a result then they destroy the DNA protein synthesis. They cause nausea and vomiting, which is the maximum seen with any other anti-cancer drug. Then they also cause bone marrow suppression. They are nephrotoxic, they are ototoxic, and they are neurotoxic. So all three toxicities are seen with these drugs. Now in this, cisplatin is most nephrotoxic. Okay? Carboplatin is most hemotoxic. Okay? देन कार्बोप्लेटिन जो है नेफ्रोटॉक्सिक, ओटोटॉक्सिक और न्यूरोटॉक्सिक कम है सिस्प्लैटिन से. The other drug, oxaliplatin, it is effective in cells which are showing resistance to cis or carby, right? Oxaliplatin is neurotoxic, तो ये neurotoxicity करता है. Then cisplatin is given by slow IV infusion. So cisplatin is given as slow infusion to prevent intense nausea, okay, and acute rise in serum creatinine. Then second point related to this is that aluminum inactivates cisplatin. So aluminum needles not to be used with cisplatin. Then there is a very specific drug, that is amifostin. Now amifostin is used or labeled for reduction of cisplatin induced nephrotoxicity. Okay, amifostin is the drug which is used to reduce the cisplatin nephrotoxicity. Amifostin is also used to reduce xerostomia in patients undergoing radiotherapy of head and neck, which involves parotid. Sometimes this is also asked as a question, that what is the drug used to reduce the radiotherapy induced xerostomia? So that is amifostin, right? Now another thing is cisplatin reduces all the ions. That means it causes hypomagnesemia, hypokalemia, hypocalcemia, hypophosphatemia. Okay, there is another drug, cyclosporin, which is an immunosuppressant which causes hyperkalemia. Then cisplatin causes AML, acute myeloid leukemia. Usually if you use more than 4 years, then cisplatin can result in acute myeloid leukemia by itself, right? The next category of drugs that we discuss are anti-metabolites, right? Now in anti-metabolites, first thing, the concept is to be understood, these attack the cells in the S phase. So only dividing cells are susceptible. S phase is the DNA synthesis phase. So this is the phase when there is synthesis of DNA. Now these drugs, they are also immunosuppressants along with antineoplastic, right? So इसमें जो the first category of drugs that comes is folic acid analogs. Now what is the drug that comes here? We all know it is Methotrexate. Another congener is Pemetrexate and Pralatrexate. Now what is the mechanism of action? The mechanism of action of these drugs is, what is the mechanism of action? They are inhibitors of dihydrofolate reductase enzyme. Now this dihydrofolate reductase enzyme actually causes conversion of dihydrofolate to tetrahydrofolate, and this tetrahydrofolate is then used in important 1-carbon chain reactions, right, and a lot of other things, important metabolisms. So this is the mechanism of dihydrofolate methotrexate. Okay, now what happens is that when this happens, when this is inhibited, then a lot of important reactions are inhibited and then toxicities occur. So there is some compound which is known as folinic acid, also called as leucovorin, also called as citrovorum factor. Now it is nothing but it is tetrahydrofolate, and this tetrahydrofolate is given to the patients to reduce the toxicity. So to reduce the toxicity caused by methotrexate, adverse effects जो इसके होते हैं उसको कम करने के लिए the patient is given tetrahydrofolate, which is folinic acid, also called as citrovorum factor, and this is known as citrovorum rescue, leucovorin rescue. ठीक है? So this causes reduction in the toxicity. Another method of reduction in toxicity is alkalinization of the urine. So alkalinization also of the urine also reduces methotrexate toxicity, right? आगे बढ़ते हैं. methotrexate क्या करती है? Now methotrexate is a very commonly used drug. आपने इसे, हमने rheumatoid arthritis में भी पढ़ा है. तो then it is used as an immunosuppressant also. It is used in many autoimmune diseases also, right? Now important thing, clearance is by renal, and so vigorous hydration is required to prevent crystallization in renal tubules. तो ये important है. Then methotrexate is the drug of choice in choriocarcinoma, right? It is also used in acute leukemias, non-Hodgkin's lymphoma, T-cell lymphomas, then breast cancers. It can also be given intrathecally in meningeal leukemias, right? Then apart from that, it is also used in rheumatoid arthritis, then psoriasis, and also used in ectopic pregnancy. Okay, so these are the various uses of methotrexate. Then the other drug, that is pemetrexate. This is used in the treatment of mesothelioma. And again, in this, if you give folic acid, then it reduces the toxicity. The another drug, that is pralatrexate. This is indicated in peripheral T-cell lymphoma. Right? So these were the folic acid analogs. Then the next category that we have is purine analogs. Right? So purine analogs में जो drugs आती हैं वो हैं 6-mercaptopurine, 6-thioguanine. Right? These are the purine anti-metabolites. Then there is a new drug, that is fludarabine. New drug तो नहीं है, पुरानी है, fludarabine. So these are purine analogs. Now what is the point here? Now these drugs, they are basically purine anti-metabolites. They are activated by the hypoxanthine guanine phosphoribosyl transferase, and the resultant nucleotide then inhibits the enzymes in purine synthesis. So these drugs, they are basically activated by the enzyme hypoxanthine guanine phosphoribosyl transferase. So this further, when it is activated, then they result in generation of nucleotides, and these nucleotides, they interfere with the purine metabolism. Okay, so these are purine analogs. Let us see their properties one by one. Now, when we had studied gout, you remember, when allopurinol is given, then dose of 6-mercaptopurine and azathioprine to be reduced to 1/4 of original dose. Okay, so this is important, that when you give them with allopurinol, which is a xanthine oxidase inhibitor, then you reduce the dose of 6-mercaptopurine. Now these drugs, mainly they are used in treatment of leukemias, and they can be acute and chronic, both leukemias. They cause bone marrow suppression, right? Then other thing important related to them, there is also, like fludarabine, there is cladirabine, and cladirabine is the drug of choice in hairy cell leukemia, and fludarabine is the drug of choice in chronic lymphocytic leukemia. Then if we use pentostatin with fludarabine is known to cause pulmonary toxicity, so they are not used. Okay, then these drugs, they cause immunosuppression. So patients to be given cotrimoxazole for prophylaxis of pneumonia, right? So these are the purine analogs. The next category that we discuss is the pyrimidine analogs. Okay, so the next category that we discuss is pyrimidine analogs. Now pyrimidine analogs में जो drugs हैं हमारे पास वो हैं 5-fluorouracil, then cytarabine, capecitabine, gemcitabine, decitabine, 5-azacitidine, right? Now in this, cytarabine is the most effective agent for induction of remission in AML, right? So this cytarabine is activated by enzyme kinase, and it forms arabinocyte CTP, which inhibits DNA polymerase, right? Now cytarabine in long-term usage and high-dose usage can result in neurotoxicity, that is ataxia, and it also causes peripheral neuropathy. Okay, 5-fluorouracil जो है दूसरी वाली 5-fluorouracil is converted to 5-deoxy-UMP, and it inhibits the enzyme TS. Now major route of metabolism is it gets converted to carbon dioxide and is excreted through respiration. Then the next drug, capecitabine, is an oral prodrug of 5-fluorouracil. Okay, then thiopurines, 6-mercaptopurine and 6-thioguanine, they are metabolized by thiopurine methyl transferase, and 5-fluorouracil is catabolized by dihydropyrimidine dehydrogenase. So these two enzymes, some people can have pharmacogenetic deficiencies, and that can affect the metabolism of these drugs in those patients. Then capecitabine can cause hand and foot syndrome in some patients, which is basically tingling, numbness, erythema, swelling, all those things. Then leucovorin, the folinic acid, it augments the action of 5-fluorouracil. uracil. Then another drug that we had seen was gemcitabine. Now gemcitabine is a very potent radiosensitizer, and it is the drug of choice for pancreatic cancer, right? Then there is another drug 5 as a Cyclophosphamide. This is used for treatment of myelodysplasia, right? And there is one more drug, cedazuridine. This is basically used in combination with decitabine for chronic myeloid leukemia and myelodysplastic syndrome, right? So these are the drugs which we have studied in pyrimidine analogs. Next category of drugs is the drugs which affect the mitosis. So mitosis affect करने वाली drugs में आती हैं विनका, alkaloids, taxanes, and some miscellaneous single drugs. So let us see these drugs which affect the mitosis. Now mitosis में सबसे पहले विनका alkaloids. तो विनका alkaloids में हमारे पास हैं विनक्रिस्टीन, विनब्लास्टिन and vinorelbin. Now what do these drugs do? They inhibit the polymerization of microtubules, right? मतलब they inhibit the formation of mitotic spindle. So these drugs basically you can say that they affect in the M phase, that is the mitosis phase of the cell cycle. Now vinblastine is known to cause bone marrow suppression, and vincristine is neurotoxicity, peripheral neuropathy कराता है, and these drugs they also can result in SIADH. This is important. It is also asked as a question many times, right? Now vinblastine is mostly used in the treatment of metastatic testicular tumors, and vincristine with glucocorticoids, it is the drug of choice for inducing remission in childhood leukemia. Okay? It can also be used in solid tumors, and it can also be used in lymphoma. So this is about vincristine and vinblastine, that they basically inhibit the formation of mitotic spindle, act in the M phase. Then vincristine is causing peripheral neuropathy, used in solid tumors and childhood leukemias. Vinblastine causes bone marrow depression and is used in metastatic testicular tumor. The next category of drugs that we have in this is taxanes. So taxanes में हमारे पास आता है paclitaxel and docetaxel, right? Now these drugs also interfere with mitotic spindle formation, and they prevent the disassembly. See, vinca alkaloids prevented assembly. They prevent disassembly of the microtubules. Okay. Now paclitaxel causes hypersensitivity reactions. Now we have a new protein bound paclitaxel, that is called as NAB paclitaxel. इसमें they have a reduced hypersensitivity. Okay. Then both cause bone marrow suppression and neurotoxicity, right? Then another thing is cisplatin reduces paclitaxel clearance, right? Then there's a new drug in this category that is called as cabazitaxel. This is used in combination with glucocorticoids for hormone refractory metastatic prostate cancer. Okay, so these are the main drugs which basically are called as mitotic inhibitors. कुछ new drugs इसमें आई हैं. Name is ixabepilong. This is used in the treatment of advanced breast cancer. ठीक है. Then there is a drug which is called as erbuline mesylate. This is again a microtubule inhibitor, and this is also used in metastatic breast cancer. Then there is a drug estromestin. Now this is basically a combination of estrogen and meclorethamine, and this is used in the treatment of prostatic carcinoma, right? It is also an anti-mitotic drug. So ये तो बात रही अपने सारे anti-mitotic drugs की. Next जो हम बात करते हैं, अब करते हैं एक category है, that is topoisomerase inhibitors, right? Topoisomerase inhibitors, इसमें जो drugs आती हैं उनके नाम है irinotecan and topotecan. They are obtained from which tree? Camptotheca acuminata, and they inhibit, as the name suggests, topoisomerase Topoisomerase 1. This enzyme nicks the DNA, introduces negative supercoil. Now this topotecan is used in ovarian cancer, right? And irinotecan is a prodrug. It is converted to active metabolite and dose to be reduced in liver failure. Irinotecan is the drug of choice in advanced colorectal carcinoma with 5-fluorouracil. Okay. Now topotecan करती है. What is the toxicity? It causes neutropenia. Irinotecan causes diarrhea. Irinotecan also causes bone marrow suppression. Then irinotecan also causes one which is cholinergic syndrome. इसमें basically diarrhea, sweating, increased secretion basically हो रहे हैं, cramps हो रहे हैं, bradycardia हो रहे हैं. So this is because of inhibition of acetylcholinesterase enzyme, right? So this is the topoisomerase inhibitors. Topotecan used in ovarian carcinoma, the toxicity is neutropenia. Irinotecan is used in advanced colorectal carcinoma with 5-fluorouracil, and इसके side effects में आता है diarrhea and bone marrow suppression and cholinergic syndrome. Then the next category of drugs in this is epipodophylotoxins. Now epipodophylotoxins में जो drugs आती हैं उनके नाम है etoposide and teniposide. Now what are they doing? They are basically inhibiting the Topoisomerase 2. That was inhibiting topoisomerase 1. This inhibit topoisomerase 2. Then they cause GI distress and they also cause myelosuppression. Then etoposide is used mainly for testicular, prostatic and oat cell carcinoma of lung, right? So this is etoposide. It can also result in acute lymphocytic leukemia. Now this usually develops at a short time interval, right? There is also absence of myelodysplastic period preceding leukemia. Etoposide is also hepatotoxic, right? The next category of drugs that we have to discuss or that is important are the anti-tumor antibiotics, right? So now in anti-tumor antibiotics, the drugs that we have are first is anthracycline derivatives. Second, we have dactinomycin. Third, we have bleomycin. And fourth, we have mitomycin. Right, now in anthracycline derivatives, the drugs that we have are doxorubicin, daunorubicin. This doxorubicin is also called as adriamycin. Okay, then we have epirubicin and darubicin. Okay, so these are the anthracycline derivatives. Dactinomycin is the bleomycin and mitomycin. Let's see these drugs one by one. Now in the anthracycline derivatives, the first category. So anthracyclines, their main mechanism of action is that they inhibit topoisomerase 2, right? Their main action is that they inhibit topoisomerase 2. In this doxorubicin and daunorubicin, they are mainly used in acute lymphatic leukemias, while epirubicin, they are mainly used in solid tumors. Okay, toxicity क्या करते हैं ये? They are cardiotoxic. They cause cardiotoxicity, and this is usually manifested in the form of dilated cardiomyopathy and congestive heart failure. Now this adverse effect can be reduced by using alpha tocopherol and dexrazoxone. Okay, right? Even if and also liposomal forms if they are used, then they can also reduce the toxicity. Plus these drugs also cause red colored urine, which is not hematuria, but they cause red colored urine. And another thing that they cause is radiation recall reaction. Now radiation recall reaction mein basically there is erythema and desquamation of skin, right? Then another metozentron is another drug which is belonging to this group, and this is metozentron is also approved for AML and advanced hormone resistant prostate cancer and also multiple sclerosis. it is less cardiotoxic and it has been used. Then there is another drug that is a new drug, that is valrubicin. This valrubicin is approved for intravesical therapy of BCG, refractory urinary bladder carcinoma, urinary bladder in situ. Okay, so this is the antibiotic belonging to the anthracycline class, and this is a new drug, valrubicin, used in intravesical therapy of urinary bladder cancer. The next drug that we see is dactinomycin. Now, what is this dactinomycin? Now, dactinomycin is basically, it inhibits DNA dependent RNA synthesis, and it is indicated for solid tumors in children. And what are they? They are Wilms tumor and rhabdomyosarcoma and choriocarcinoma, right? It is also a radio sensitizer. Okay, so this is dactinomycin. The next drug that we discuss is bleomycin. Now, bleomycin is a cell cycle specific glycopeptide drug, and this acts in G2 phase. It causes DNA strand breakage and free radical formation, right? This toxicity that it causes is cutaneous toxicity. It also causes pulmonary fibrosis, which is very important. Then next antibiotic that we discuss is mitomycin. Mitomycin is basically an alkylating agent, and it is used for intravesical therapy to treat superficial bladder cancer and anal carcinoma, right? Then it can cause, what is the toxicity? It causes hemolytic uremic syndrome. Then it is also used as an adjuvant to X-ray radiation to attack hypoxic tumor cells, right? So that is about mitomycin. Next category of drugs now that we discuss are the targeted anti-cancer therapies. Okay, so in targeted anti-cancer therapies, let us see these drugs specifically target the small molecules which are present, and these drugs can be divided into monoclonal antibodies, or they can be small molecule inhibitors. Okay, so let us see them one by one. Now, monoclonal antibodies के अंदर जो drugs आती हैं, the classification is huge, so we'll take them one by one, right? So drugs, the first classification is immune checkpoint inhibitors. Now, what are the drugs which come under immune checkpoint inhibitors, and what is immune checkpoint inhibitor? Now, it was basically it is seen that certain immune regulations can be inhibited, and that will result in anti-cancer effect. Now, the first checkpoint receptor is PD1, that is programmed death receptor. Okay, then next another one is CTLA4. Then we have one more, that is PDL1, and then we also have CD80 or 86. Now, what are the drugs which are acting on these? Let us see. Programmed cell death receptor, programmed death receptor पे act करती है nivolumab. Okay, then pembrolizumab and semiplimab. When the antigen binds to these receptors, they result in T cell inhibition. क्या करते हैं ये? T cell inhibition करते हैं, right? So they help in destroying the cancer cells. Then PDL1 पे आती हैं atezolizumab, then avelumab and durvalumab. Okay, then drugs which are coming on CTLA4 inhibitor है ipilimumab. ठीक है, this drug is used for the treatment of malignant melanoma. ठीक है, then we have a lot of drugs which are acting against CD antigen. Now, CD antigens होते हैं जैसे CD3, 19, 20, 22, 30, 33, 38, 52. All these antigens are there, and there are many drugs which are active against these antigens. जो सबसे important या एक common most है वो है जो important है rituximab, which is acting against CD20. It is used in SLE, in idiopathic thrombocytopenic purpura, in rheumatoid arthritis. Then it is used in hemolytic anemia. It is also used in non-Hodgkin's lymphoma, and it is used in CLL, that is chronic lymphoid leukemia, right? So this is about the first category. Then there are antibodies, monoclonal antibodies. The third category, that monoclonal antibodies against growth factor receptors. So what are the growth factors that we have? We have EGF, we have VEGF, we have HER2, then we have PDGF. So these are various growth factors, and they are associated with development of many cancers. Now coming to the drugs that we have. So there is cetuximab, then panitumumab, and we have necitumumab. Now these are monoclonal antibodies against endothelium epidermal derived growth factor receptor. It is also called as human epidermal growth factor 1. Okay, now cetuximab is used in colon cancer and head and neck cancer. It can result in skin rash, then it causes hypersensitivity, and it also causes hypomagnesemia. Then after cetuximab we have another antibiotic, which is panitumumab. Now this is again active against EGFR only, and this is also used in colon cancers, right? Then there is one drug, trastuzumab, and another uska congener hai pertuzumab. Now these are monoclonal antibodies. They are active against human epidermal growth factor receptor, or what we call as HER2, right? Now this trastuzumab is used in the treatment of breast carcinoma. And what is the toxicity? The toxicity that it causes is cardiotoxicity, right? Then there is another congener of this drug, that is trastuzumab. This is a conjugate of trastuzumab and mirtazine. It is a conjugate of trastuzumab plus mirtazine, right? And it is approved for the treatment of metastatic breast cancer. Then another drug is pertuzumab. Ye tha. So pertuzumab is also basically used in combination with trastuzumab for the breast cancer only. So these drugs are basically used in the treatment of breast cancer. Then there is a drug called as bevacizumab. This bevacizumab is basically active against VEGF, that is vascular endothelial growth factor, right? And it is basically antibody against vascular endothelium growth factor, and there is a drug which is called as ramucirumab. This is active against VEGF receptor. Okay. Now this bevacizumab, basically it is active against VEGF, so it reduces angiogenesis. So it is approved for breast cancer, then renal cell carcinoma, non-small cell lung carcinoma, then glioblastoma, multiforme, all these cancers. Okay. Ramucirumab is basically approved for use in non-small cell lung carcinoma, and it is also used in gastroesophageal junction carcinoma, right? Then we have another drug that is called as olaratumab, and this is against platelet derived growth factor, and it is used in approved for the treatment of soft tissue sarcoma. Okay, so this is olaratumab, and this is the usage. Then we have other drugs also, small single drugs हैं जैसे है denosumab. It is used against the rank ligand, and denosumab is also used in osteoporosis, and it is also used in giant cell tumor. Okay. Next we have dinutuximab. This is active against glycolipid GD2, and it is approved for the treatment of neuroblastoma, right? Then we have elotuzumab. It is used in multiple myeloma. Then mogamulizumab. It is against CCR4, and it is used in mycosis fungoides, and it is also used in Sézary syndrome. Okay, so these are the various monoclonal antibodies which are used against growth factor receptors and miscellaneous drugs also. Then the next category is small molecule inhibitors. right? Now small molecule inhibitors में there we have tyrosine kinase inhibitors, right? Now tyrosine kinase inhibitors में the drug that we have is imitinib. This is an oral drug and it is used in the CML. Okay, it is basically an inhibitor of ABL kinase. Then there are other drug is also there in this category, that is dasatinib and nilotinib. Right, now imatinib is a drug of choice for it is used in CML and it is also used in another tumor, that is gastrointestinal stromal tumor, right? Then other drugs that we have, one more is there, geftinib and erlotinib. Now these drugs are inhibitors of tyrosine kinase associated with epidermal growth factor receptor. These drugs are indicated in non-small cell lung carcinoma, and the drug that we have here is erlotinib. This is specifically effective here. It is also indicated for pancreatic carcinoma. Okay? Then there is a drug which is called as sorafenib and sunitinib. These are small molecule inhibitors of tyrosine kinase. They are used in renal cell cancer. Sorafenib is also used in hepatocellular cancer. Sunitinib can also be used in GI stromal tumor. They cause hypertension as an adverse effect. Next drug that we have is dapatinib. It is indicated for breast carcinoma. It inhibits tyrosine kinase associated with EGFR. Right? Then we have a drug which is called as midostaurin. This is basically, it inhibits the FLT3 and PDGF signaling molecule, and it is basically approved for mast cell leukemia and systemic mastocytosis. Right? Then another drug that we have is pazopanib. It is basically used, it acts against VEGF receptor and it is used in advanced renal cell carcinoma. Then we have larotectinib. This is an inhibitor of tropomyosin kinase, and it is the first drug to be specifically developed and approved for solid tumors with NTRK mutations, right? So this is these are some more important drugs. Then let us discuss some other targets also, and one of them is proteasome inhibitor. इसमें नाम आते हैं bortezomib and carfilzomib. They act by inhibiting the proteasome and they are approved in multiple myeloma. Then next category that we have is histone deacetylase. इसके अंदर जो ड्रग्स आती हैं वो है vorinostat and romidepsin. Another drug that we study in this category is tabinostat and belinostat. Now this is approved for multiple myeloma. This is approved for T-cell lymphoma. Right? Then we have a drug which is tazametostat, and this is approved for epithelioid sarcoma. Right? Then we have mTOR inhibitors. Now, what are the drugs which come under mTOR inhibitors? In this we have everolimus and temsirolimus. They are approved for renal cell carcinoma, and this is used in breast and pancreatic and brain and renal cell carcinomas. Okay, mTOR inhibitors. The next category of drugs that we have is PARP inhibitors. So PARP inhibitors में जो drugs आती हैं वो हैं olaparib and rucaparib. Then another drug is niraparib. Now these drugs are used in breast carcinomas. The next category is CDK inhibitors. In CDK inhibitors we have palbociclib, then we have abemaciclib, and we have ribociclib. Right? These are used in breast cancers. Then next category we have is PI3 kinase inhibitors. In PI3 kinase inhibitors, the drug that we have is Adalimumab, copanlisib, then duvelisib and umbralisib. Another drug is alpelisib. Okay. Then another category is apoptosis inhibitors. In this we have ingenol mebutate. This is used in actinic keratosis, right? Then we have protein synthesis inhibitor, and here we have omacetaxin, which is used in CML. Then we have hedgehog pathway inhibitors. So hedgehog pathway inhibitors में the drugs that we have is sonidegib and vismodegib, right? These are the new anti-cancer drugs and they are used in basal cell carcinoma. Then next category drugs that we have is BCL2 inhibitors, right? BCL2 inhibitors में we have the drug that is venetoclax. Then we have isocitrine dehydrogenase 2 inhibitors. In this, the drug that we have is INI-CET, right? Then there is a drug which is called as selinexor. This is a selective inhibitor of nuclear export, that is SINE, right? Now this basically inhibits this receptor, and by inhibiting it, it results in accumulation of tumor suppressor genes. Okay, it is used for oral treatment of B-cell lymphoma. The next category that we have to discuss is the hormones which are used as anti-cancer agents, right? Now this we have almost done in the hormones, but we'll just have a quick recap here. Now hormones में सबसे पहले आते हैं corticosteroids. So these corticosteroids are combined with the ondansetron in chemotherapy associated vomiting, plus they are also used in the leukemias and lymphomas, right? Then we have estrogen, which were earlier used, high dose estrogen, but now not used. It is also effective in prostate cancer, so it was used in breast and prostate cancer earlier. Then progestins, they are useful in breast cancer and endometrial cancer, right? Then we have anti-androgens. In anti-androgens, these are drugs like androgen inhibitors. So we have flutamide and nilutamide, enzalutamide, bicalutamide, and darolutamide. They bind to the androgen receptors and they inhibit, and so they are used in the prostatic cancer. With GN, gonadotropin releasing hormone, they produce a complete androgen blockade. Okay. The next category is gonadotropin releasing hormone agonist. तो इसमें हमारे पास जो ड्रग्स है वो है गोसेरेलिन, नेफेरेलिन, leuprolide. These drugs are used in prostate cancer, but they can cause flare-up reaction. Then we have GnRH antagonist, in which we have cetrorelix, ganirelix, tigarelix, ibarelix. Now these basically drugs, they are used in the treatment of prostate carcinoma. Then we have anti-estrogens. Anti-estrogens, we know they are tamoxifen and torrenefin. Then we also have a drug fulvestrant, which is an estrogen receptor antagonist. They are all used for breast cancer and advanced metastatic breast cancer. Now then aromatase inhibitors, they are also effective in the advanced breast cancer, right? So in aromatase inhibitors we have aromatase inhibitors में the drugs that we have are aminoglutamide, then anastrozole, exemestane, and letrozole, right? They are useful in advanced breast cancer. Then we have some other anti-cancer agents like asparaginase specific enzymes. So इसमें आती है drug L. This is L-asparaginase is the enzyme which is used for the treatment of acute lymphoid leukemia. Okay. Then there is one drug, calasparagase, pegol. This is a pegylated substance. This is a long-acting asparaginase specific enzyme. This is approved for the treatment of ALL. Next we have pentostatin. This drug is used in the treatment of hairy cell leukemia. Okay. Then we have lutetium 177 dotatate. This is a somatostatin receptor antagonist, and it is approved for the treatment of neuroendocrine tumor. Okay. A few more drugs are there. One is tagraxofusp. It is basically a diphtheria toxin conjugated with interleukin 3, and it is used in the treatment of BPDCN in adults and pediatric patients more than 2 years of age. Octreotide, you know, somatostatin analog hota hai, and it is used in acromegaly and esophageal varices. Then we have one drug which is called as plicamycin, which is used in hypercalcemia of malignancy, right? Hydroxyurea, which is used in sickle cell anemia, thrombocytopenic purpura, polycythemia vera, and also used in CML. Then tretinoin or retinoic acid. Now this is basically used in acute promyelocytic leukemia. Then we have AS2O3. This is used in acute promyelocytic leukemia. Another drug is sapuleucel T. It is an immunotherapy used in prostate cancer. A very important drug, thalidomide. Many times asked also because it was banned for creating phocomelia. Now this is used in multiple myeloma and melanoma. इसका एक और congener है, that is lenalidomide. This is more potent and non-teratogenic, and this is used in mantle cell lymphoma. Apart from this, it is also used in erythema nodosum leprosum and in skin manifestations of SLE. So thalidomide के ऊपर ये questions आते हैं. इसमें एक नया drug और आया है, that is pomalidomide. So thalidomide is a very important question, and you should always remember this drug. Then a few more drugs. Zoledronic acid. It is a bisphosphonate, right? Methotrexate. It is basically adrenocortical carcinoma. Then aldesleukin. It is recombinant interleukin 2 and renal cell carcinoma and malignant melanoma. Then we have denileukin, deftetox. It is interleukin 2 with diphtheria toxin and is used in cutaneous T-cell lymphoma. Okay, now just adjuvant chemotherapy किसको बोलते हैं? It is administered after surgery or chemo. And neoadjuvant किसको बोलते हैं? It is basically administered before surgery or radiotherapy. Okay, not chemo, radio. So adjuvant is after and neoadjuvant is before. So this were the important drugs which we have to complete in cancer. So students, now coming to the last part of anti-cancer drugs. Here we are going to discuss the immunomodulators. Now immunomodulators पे काफ़ी सारे questions आते हैं, so इसको cover करना ज़रूरी है. The first drug that we talk about is glucocorticoids, and we know glucocorticoids are the most commonly used immunosuppressant, right? Because they inhibit the production of bradykinin, prostaglandin, leukotriene, histamine. Now, one important thing that we just need here is like continuous administration of glucocorticoids increase the metabolism of IgG. They are used as first-line drug for solid organ and stem cell transplant recipient also. Okay, so apart from that, they are also used in graft rejection and graft versus host disease. They're used in bronchial asthma, in rheumatoid arthritis, and in idiopathic thrombocytopenic purpura. So a lot of uses for glucocorticoids are there. The second category of drugs that we will see is calcineurin inhibitors. Okay, now calcineurin inhibitors क्या होते हैं? So calcineurin is required for activation of NFAT, that is nuclear factor of activated T cells, which in turn increase the transcription of interleukin 2, and this interleukin 2 is a chemotactic factor, is a factor of inflammation which increases the immune reactions. So now there are two drugs, calcineurin inhibitors हमारे पास हैं, cyclosporin and tacrolimus. Now these drugs, they inhibit the activation of NFAT by binding to immunophilins, that is cyclosporin binds to cyclophilin, and tacrolimus binds to FKBP. So there is an inhibition of interleukin 2. So these two drugs, they are used in graft versus host disease, they are used in organ transplantation, they are used in autoimmune diseases, right? Now what are the toxicities caused by these? So it is seen that cyclosporin causes nephrotoxicity, causes hepato, then hyperkalemia, a lot of toxicities. It causes hyperkalemia, hyperlipidemia, hyperuricemia, hyperglycemia, hirsutism, then gum hyperplasia, neurotoxicity. Okay, it causes hypertension. So these are the toxicities caused by cyclosporin. And what are the toxicities caused by tacrolimus? Tacrolimus causes hyperglycemia and neurotoxicity, right? These are the toxicities caused by tacrolimus. Tacrolimus is more potent than cyclosporin. Okay, and cyclosporin में nephrotoxicity is the main reason to stop the treatment, right? Then after that, the other drug that we study in immunomodulators is proliferation signal inhibitors. Okay, proliferation signal inhibitors. Now इसमें जो drug आती है, its name is sirolimus. They basically inhibit the mTOR, right? And what is mTOR? mTOR is mammalian target of rapamycin. So by inhibiting the mTOR, they also inhibit interleukin 2, right? It is used as immunosuppressive agent in organ transplantation and GVHD. Another use of sirolimus is that it is used in cardiac stent to reduce the chances of reocclusion, right? Its major adverse effect is thrombocytopenia. ठीक है? Now sirolimus is not nephrotoxic. There is another drug in this category. इसका नाम है everolimus. It is also used in heart transplant. Okay. Now this is also a drug which is used in transplantation, and they increase the risk of hemolytic uremic syndrome. Then everolimus is approved recently for subependymal giant cell astrocytoma associated with tuberous sclerosis, right? So this is the important drug. Sirolimus and tacrolimus, they are also used in what we call as drug-eluting stents and cardiac transplantation, and recently it is approved for treatment of this disease associated with tuberous sclerosis. The next category drug that we have is purine synthesis inhibitor, which consists of mycophenolate. This mycophenolate inhibits the iosine monophosphate dehydrogenase and it converts it into mycophenolic acid. And this is used in patients who are refractory to steroids. Okay. Toxicity mein it causes myelosuppression. Okay. The next drug that we have are anti-metabolite. In anti-metabolites, the drug that we study is azathioprine. So this is used as an immunosuppressant, but not as anti-cancer. It is a prodrug, okay, and is converted to 6-mercaptopurine, which is an anti-cancer drug, right? The only toxicity that it causes is bone marrow suppression. Another important thing which we have repeated many times: dose to be reduced if used with allopurinol. Okay. Then other drugs like anti-cancer drugs, cyclophosphamide, methotrexate, clonabutazol, they are also used. Then there was a drug which we studied in gout, leflunomide, which is an inhibitor of, it inhibits what? Dry hydroorotate dehydrogenase. This is basically used in polyoma virus nephropathy, right? Then we had also done thalidomide in the last anti-cancer drugs. So thalidomide, we know it's a teratogenic. Currently it is being used in malignant melanoma, multiple myeloma, then erythema nodosum, leprosum, and skin manifestations of SLE. Then इसका एक congener है lenalidomide, and this is basically approved for multiple myeloma and myelodysplastic syndrome. Okay. इसके अलावा then we have lot of monoclonal antibodies, and monoclonal antibodies बहुत सारी हैं. उसमें I know you cannot ratify each and every drug, and it is very difficult to remember all of them, but I still suggest that you at least remember 10 or 20 of them, the most important ones, which will help you in covering the exam. So इसमें और क्या क्या drugs आती हैं देखते हैं. फिर जाते हैं co-stimulation inhibitors. Okay. Now co-stimulation inhibitors में the drugs that we have are abatacept and belatacept. They act by inhibiting the CD80 and CD86. Then abatacept is used in severe rheumatoid arthritis, and this is belatacept is used in kidney transplant. Okay. आगे बढ़ते हैं तो फिर आता है interleukin 1 inhibitor. Interleukin 1 inhibitor हमने पढ़ा है rheumatoid arthritis में, that is known as anakinra, right? Then other drugs में एक आती है nintedanib. This is basically a small molecule kinase inhibitor, and it is used for idiopathic pulmonary fibrosis. Okay. Then there is another drug, apremilast. This is a phosphodiesterase 4 inhibitor, and it is used for plaque psoriasis and psoriatic arthritis. ठीक है. फिर आते हैं कुछ immunostimulants. So what are the immunostimulants that we know about? There is one drug called as levamisole. This is used with 5-fluorouracil for treatment of colorectal carcinoma. The adverse effect that it causes is agranulocytosis. Right? This levamisole is also used for treatment of pediculosis. Okay? It was also earlier used as anti-helminthic drug. Also anti-helminthic drug के रूप में it was used. Then we have BCG. This is the Bacillus calmette-guerin, which is useful for intravesical therapy of superficial bladder cancer. Okay. Then we have some cytokines. Cytokines में आते हैं हमारे पास interferons, then colony stimulating factors, then interleukins. ठीक है. तो अब इसमें कौन कौन से हैं? एक होता है aldesleukin. This is basically recombinant interleukin 2, and it is used in malignant melanoma and renal cell carcinoma. Then second we have is filgrastim. Is basically recombinant GCSF, and we have another drug that is sargramostim. This is GM-CSF. They're used for chemotherapy induced myelosuppression. Okay. Then immunostimulants के बाद नेक्स्ट हम पढ़ते हैं ड्रग्स विच आर यूज्ड इन ट्रीटमेंट ऑफ सोरियासिस. तो वैसे तो हमने पहले भी पढ़ा हुआ है सोरियासिस के ट्रीटमेंट के बारे में, स्किन और जब हमने वो सब पढ़ा था. एक बार और रिपीट कर लेते हैं. सोरियासिस is basically a chronic skin condition. We all know that it is a chronic skin condition which is characterized by overactive immune system. Psoriasis हम इसलिए पढ़ रहे हैं क्योंकि psoriasis is an immune disorder, overactive immune system. So क्या हो रहा है? Basically there is excess epidermal proliferation with dermal inflammation, right? Now what are the drugs which are used? So topical treatment में we can use corticosteroids, but long term use can result in atrophy of skin. Okay. Then topical vitamin D, we use calcipotriol. This can be used, it suppresses the proliferation. And then another drug is tazarotene, which is a topical retinoid, right? So it also has anti-proliferative and anti-inflammatory action. Then we have photochemotherapy. और photochemotherapy में हम क्या देते हैं? We give PUVA therapy, right? But this PUVA therapy is associated with increased risk of melanomas, okay, and skin cancers. Then oral drugs. Now what are the oral drugs that are given? So oral drugs में we give Methotrexate, cyclosporin. These are anti-immunity drugs. Then acetretin, which is a retinoid, and apremilast, which we just saw that it is basically a phosphodiesterase 4 inhibitor. Then never give corticosteroids as it can result in withdrawal होने पर it results in life-threatening pustular psoriasis. Okay. So oral glucocorticoids are not given in psoriasis. We give topical, so we can give topical, we give phototherapy and oral drugs. Then some biological agents can be given, like monoclonal antibodies are there. TNF alpha inhibitors में हम दे सकते हैं adalimumab, certolizumab, then etanercept. Biological agents which are used are TNF alpha inhibitors, adalimumab, certolizumab, etanercept. Then ustekinumab, which is a monoclonal antibody against interleukin 12. Then guselkumab and diltiazem, which is against interleukin 3, and so on and so forth. So many antibodies, monoclonal antibodies are used in psoriasis. So with this we complete the anti-cancer and the immunosuppressant chapter.